Welcome. Thanks for watching this dairy video brought to you by DairyXNet. In this video, Dr. Robert VanSaun joins us to talk about a mammary gland dissection and discuss the causes of mastitis. If you'd like alerts on new articles, videos, and resources, be sure to check out the video description below to follow us on Facebook and Twitter, or sign up for our newsletter. And don't forget to subscribe to our channel here on YouTube. Today's presenter, Robert VanSaun, is an extension veterinarian and professor of veterinary science at Pennsylvania State University. He has been on faculty at Penn State for 15 years with responsibilities in teaching, extension, and field investigation. Dr. VanSaun received his veterinary degree and completed a master's degree at Michigan State University. He also earned a PhD degree in ruminant nutrition from Cornell University. He was in private veterinary practice in New York and Michigan and an ambulatory clinician for Oregon State University. His research spans across various species, including dairy and beef cattle, horses, and small ruminants. His primary research focus in dairy cattle is to address nutritional needs of early lactation cows to prevent disease.
Hello. Welcome to this DairyXNet informational video on mastitis. I am Dr. Robert VanSaun, an extension veterinarian with Pennsylvania State University, and we'll be talking about one of the single most important diseases in dairy cattle, namely mastitis. What my topic is, I'm going to use dissection to show you the physical anatomy of the mammary gland, or the udder, and use this to explain how mastitis comes about. And as my title for this video indicates, mastitis is actually a disease that comes from the outside into the mammary gland, and it is not a disease that comes from the blood or inside the cow. So let's get started. First, we all are familiar with the use of somatic cell counts to monitor mastitis and what we call intramammary infection. In these two graphics here, we can see that we have acute mastitis, where you have a rapid increase in somatic cell count and then a slow progression downward back to normal again, indicating that that cow was either able to fend off that infection or was treated appropriately and allowing her immune response to correct the infection. In this second graphic, you can see there's a very high somatic cell count over a long period of time, and so this is a chronic infection. However, in spite of us depending upon somatic cell counts to monitor mastitis, the cell count itself doesn't tell us much about the disease, the cause of the disease, which bacteria, or even the duration, unless you're looking at these numbers over time. Now let's look at when mastitis is our greatest concern, and there's really 2 points in the life cycle of a dairy cow where mastitis is a high risk. Starting with calving, we can see this red line has this big increase, and this is usually due to, one, a decrease in the responsiveness of the immune system of the cow, or potentially due to pathogen buildup on the teat end, or from the environment. If we follow the red line as the animal progresses through her lactation, her risk for new infections goes down, although that is influenced by many factors. But then when we dry that cow off in preparing for the next lactation, we see this huge spike. And again, this is the big problem due to the cessation of milking, thus losing a flushing action of getting the bacteria that enter through the opening of the teat, which we'll discuss, and the remaining milk that is in the mammary gland, as we'll see, residual milk, is a perfect culture medium. So this combination of the milking process, pathogen buildup and alteration in the immune response are the key players in our risk for mastitis. So let's come back to the immune response. There's what we call three tiers. Invading microorganisms first have to face the physical barriers. And this is really the single most important part of preventing mastitis. The skin of the teat, the keratin plug, as we'll show, and the teat sphincter itself are really the primary barriers to preventing mastitis. Should the bacteria get through those physical barriers, then of course we have the somatic cells. These are neutrophils, macrophages, and the inflammatory response that comes from the blood into the mammary gland to help fight off the bacterial infection. And then finally, we have what most people think about when we talk about immunity, and that's specific immunity, where the cow builds up antibodies or where we can use a vaccine to try and prevent mastitis, or the production of cytotoxic cells. So let's take a look at this udder here. We can see the four teats and the skin between the teats. And ideally, the skin should be nice and clean. The teats should be clean, free of manure or bedding, other material. And then we can look at the teat ends of the cow and describe that opening, that physical barrier. So this video here, we're showing the structural components, the physical barriers that are important to preventing mastitis. So let's come and talk a little bit more about this primary barrier, what we call the teat sphincter. This is the actual opening. This is the single gateway that bacteria or other pathogens can enter in and cause mastitis. So this sphincter has three components to it. One, we have the teat sphincter muscle itself. And I'm highlighting here that protein in the diet can affect muscle integrity and strength, as well as calcium and muscle contraction. So this is why cows with hypocalcemia or low blood calcium, whether it be clinical in a milk fever cow or subclinical, could have compromise of the muscle tone, thus giving some gateway for bacteria to enter because the teat opening may be compromised. The next level of protection is what we call the keratin plug. These are special cells that have antibiotic type properties or antimicrobial type properties that line the actual street canal, the tube by which milk comes out or bacteria goes in. Keratin produced by the epithelial cells is very dependent upon vitamin A status and zinc in the diet. And then finally, the epithelium, the lining tissue of the street canal, similar to the lining or your skin, this is what generates the keratin plug. But again, the health of the epithelium is dependent upon a number of nutrients, namely, again, protein, vitamin A, and zinc, to help keep a good, healthy production of the keratin plug and integrity of the opening of the street canal. The one thing we need to remember is no matter how much we manipulate our nutrition, which seems to be our single focal point in dealing with many of these problems, we need to remember it's the environment, and there are pathogen overloads that can occur that can compromise even the best nutritional program or management program. Now, again, our primary barrier is this street canal, the teat opening, and so we can evaluate the quality or the condition of the teat end. And there's a number of scoring systems. This is one we use here at Penn State, where you can see on the left side of the screen here We have a nice opening, nice epithelial layer, clean teat ends. Here we have a little bit of raising of the sphincter and epithelium, but yet the teat opening and the epithelium is very smooth, and so there's no breaks for potential bacteria that may be colonizing the skin to get through. When we get up to where we start to have this rough appearance, and even very rough where essentially keratin and epithelial cells are hanging out, now we've compromised that barrier and we have a much higher risk for mastitis problems. The other thing we talked about, of course, is the pathogen load. So we can look at udder hygiene, and so we can evaluate using, again, a standardized scoring system, the legs, the udders, and the upper flanks and upper legs in terms of how much manure or dirt is present on those parts of the anatomy that could, with water use, or if it's towards the teat end, allow for bacteria to colonize the udder and leak down into the ends of the teat during the milking process and ultimately get projected on up into the street canal and up into the mammary gland itself to cause the mastitis. So let's start to take a look at these aspects. We'll start dissecting the teat here from the teat end to show you the street canal and the various structures that are part of this primary barrier to mastitis. The street canal, as we said, is lined with the keratin plug, and that's a very important aspect in preventing or acting as the barrier for movement of bacteria up through the street canal. As we move through that very short street canal, going from the outside of the teat to the inside to an area of where milk is held, this is called the teat cistern, we see flaps of skin, the epithelial lining right on the inner side of the street canal. This is called Furstenberg's rosette. These are pieces of the skin that fold over the inner opening of the street canal, and this is what helps prevent leakage of milk in between milkings. This Furstenberg's rosette can be damaged by any teat trauma, having a stepped-on teat, or if you use things like dilators or trying to open a teat end using a splicing type device to help hard milkers. We can see the street canal here, and as I push this wooden applicator through the street canal, you can sort of see little flakes coming up, and that's part of the keratin plug. Again, this is a very important aspect of preventing movement of bacteria and having antimicrobial properties to kill off bacteria that start to enter this street canal. Looking at this other teat that's been dissected, you can see the thickness of the end of the teat, and that's the sphincter muscle. We can see the thick muscle here, and this is important in constricting and holding that teat end closed in between milkings. In this final video clip, I've opened up the teat, and you can see what we describe as the teat cistern and its epithelium. This is very smooth. This is where milk fills in during the milking process, sort of plumps the teat up. You can look at this epithelium, and this epithelium is very sensitive to potential damage, and you could get what we call milk stones, inflammatory tissue. You can have scarring in here that can impede the flow of milk and make cows slow milkers and put them at greater risk for mastitis. So this diagram then is sort of reviewing that anatomy we've just looked at, and we focused on this red box here of the teat itself. If we look at it in larger size, we have the sphincter muscle in this area here, as we saw, the street canal with the keratin plug, and then the Furstenberg's rosette, these flaps of epithelial tissue over protecting the inner lining. And then we have the teat cistern, where the milk is being held in the teat. And now, so if the bacteria move through this process, get into the teat cistern, then they pretty much have a free passageway into the gland itself. So if we come over to our diagram here again, we can see the gland cistern here is where all these major ducts that are the pathways of milk. These little purple areas are basically the specialized alveoli or milk secreting cells. And as milk comes into the lumen here, it moves down into these ductal systems and they start to coalesce together, and then finally down into the gland cistern. Between the gland cistern and the teat cistern is what's called the annular ligament or annular ring, which is just sort of holding back the milk that's collecting in this the gland cistern. So here we're looking at the street canal again. We mentioned the importance that this is to the primary physical barrier. And one of the challenges we have is we tend to want to put material, namely mastitis treatments or antibiotics to prevent mastitis infections during the dry period. To get it into the udder, we have to go through this street canal. Now, most of you may know mastitis tubes can come in short or long tubes. In the old days, we used these longer tubes to insert, and as you can see in the video here, the long tubes compromise the street canal and actually push material all the way up and into the teat cistern and potentially could even compromise the Furstenberg's rosette. This is why many of the companies have gone to the short insertion or have some kind of short tip. You can see with the shorter tip, you're only just going through that little bit of the outer opening and you're in the street canal itself, not all the way through and compromising that street canal and the keratin plug, and you're able to provide the material into the teat and then massage it up into the gland. Looking here again, we can see the opening of the teat cistern, and then you have sort of this rounded ring structure, that's the annular ligament, and you're looking down actually into the gland cistern area, the collection area for the milk. This other video here is also just another perspective of looking at that annular ring or annular ligament leading into the gland cistern. So let's take a look at, if we come up from the gland cistern, then we have these major collecting ducts that transport milk from the milk secreting specialized cells here, the alveoli. These will have muscle cells around them that will constrict during the milking process under the influence of oxytocin, pushing milk into the ductal system and on down. Now, when we think about somatic cells do come from the blood, unlike the bacteria that are coming up the collecting tubules. Somatic cells normally are present in milk in typically low numbers unless there is some kind of inflammatory process taking place. If we look at the second diagram, this is sort of showing the progression that occurs in a mastitis event. So if we start down at the bottom at number 1, bacteria enter through the Teat duct, as we described, moving up through the ductal system, remembering that milk is a very good culture media for many bacteria. And so the right side of this diagram that's highlighted here shows the initial changes that occur. We have proteins and electrolytes or salts coming in from the blood in the inflammation, triggering of the inflammation. So the somatic cells that are naturally in the mammary gland release signaling compounds that change the flow and bring in these nutrients to try and help fight off the infection. Plus they bring in many more somatic cells. So this is why somatic cells increase in the situation of an infection. The left side of this diagram shows what happens if the bacteria sort of get the better part of the immune system and aren't cleared right away. We could have just basically some damage to the milk cells, and of course once they're damaged they can't regenerate in that lactation, and so this is why we see lower milk production in cows that have mastitis. If that infection continues and the immune system cannot overwhelm the infection, then we see more and more damage, and then ultimately we may see complete alveoli being atrophied and scar tissue. So this is going to be the knots that we might be able to feel. And notice here right in the middle is this milk clot that forms that basically kind of walls off this area that's affected and helps to try and minimize the spread of this infection. So let's take a look at the inner workings of the mammary gland here. Here we're looking right down through the annular ligament into the ductal system that's emptying into the gland cistern. You can see this whole network, tremendous network of ducts coming down in here. So you can have some great appreciation for, you know, the movement of milk through the mammary gland and the total production potential of the mammary gland. This other video then shows me probing down into the ductal system of the mammary gland, and even though palpating or feeling around the quarter here, I didn't identify any knots or potential mastitis lesion, you'll notice this small clot of milk that I bring out on the scalpel blade here, and this is a part of a milk clot that would be up in the ductal system, as we described in the previous slide, you know, indicating a walling off and also a blockage of that part of the duct to help facilitate fighting off the infection of the mammary gland. So hopefully you've gained some appreciation for the progression of mastitis and the entry of mastitis causing organisms, and you would think that for a disease process that has only one portal of entry to the organism, that this should be a fairly easy disease to minimize in our dairy cows. However, that's not the case, as we know. And part of this is due to what we call multifactorial causes of intramammary infection. So if we start off just, you know, understanding the pathogen itself, the type of organism. Is it a bacteria, which is most of our problems, but we do see yeast, molds, and mycoplasma. You know, what are the growth requirements and how virulent is that pathogen? And is that pathogen, the bacteria, resistant to certain antibiotics? Another thing we need to think about, we talked about, is the environment, you know, the pathogen load. Are the cows dirty because of, high moisture level, high organic matter in the bedding? Is there heat stress that could be compromising the immune response? Then, of course, one of the big things is the milking machine. Is it working properly? Is the vacuum level or fluctuation? Is there leaks? What's the pulsation ratio? Is the equipment dirty or contaminated? Are the milkers over-milking cows and causing damage to the teat ends? Are we using improper milking procedures and not prepping the udder well and not getting the teat ends clean? And then finally, we have just overall management, the size of the herd, time in the holding area, the type of stall, the cow comfort in the stalls, the type of bedding, the amount of manure contamination out in the environment, cow handling procedures, and then dry cow therapies and dry cow management, transition cow management. So, and then finally, we have cow factors, the age of the cow, the stage of lactation, as we indicated, health status. We're now looking at genetic predisposition to mastitis, and of course, the role of the immune status of the cow herself. So it's all of these things that make and continue to make mastitis the single most important disease process on the dairy farm. With that, I thank you for your attention, and I hope you have learned a bit more about mastitis. And remember to visit the Dairy XNet website for other informational videos. Thank you.